right? So that's what our prevention branch is here to do. And if we can all ask ourselves, what is one thing we can do for suicide prevention? And that is to learn what are the signs and symptoms and to teach others how to recognize that and then how to get some help. So Sarah, who leads our prevention branch, has a robust social media account that will have the specifics on where to get access to those trainings. So that's Jibwit Guam. Our Instagram is Jibwit Guam, right? That's correct. Okay, so everybody follow us on Instagram if you're not already, and we'll be happy to sign you up for some trainings, whether it's individually or by your organization. And then on the treatment side, right, so we have Governor, we have our inpatient detox unit. We have some social detox homes. Shout out to Salvation Army, right? Lighthouse Recovery, Shoring West Care as well. And then in-house, we're doing the Center of Hope, which is for the children and families. And we're hoping to expand that as well. So thank you also for supporting us with some extra funds to expand those beds, right? That's going to go a long way for us. But one of the big things that I really want to recognize here is our peers. So Guam Behavioral Health, as well as all the other organizations, value the lived experience that you bring. And Brian, you're our champion, right? Brian and Toby and all the peers that we employ. Let's give her, I'll just close now. Everybody just give a round of applause for those that are in recovery.
Jesus Masi Carissa. I now want to give the floor to the Honorable Lourdes A. Leon Guerrero, Governor of Guam. Let's give a round of applause.
First, I'd like to congratulate Carissa now as she has been confirmed as the Director of Guam Behavioral Health and Wellness Center. Jibwit, congratulations. Like to thank Dr. Cooper Nurse here for stepping up to be our assistant deputy director and doing a great job. And I just want to say that I've known Carissa since she was like, I think, 12 years old, and a great leader, I think, for our community in such a great, complicated, difficult, painful at times programs that she has to lead in our Jibwit. And kudos to her for her commitment, her persistence. I'm telling you, she calls me up at 2 in the morning and wants to talk about the mobile response team, the 988, and just want to say that under her leadership, together with of course, Therese Ariola, they really set up the detox unit. Jibwit got out of their receivership. They've now instituted billing services for revenues. Just many, many accomplishments that are so many to publicize. But you know, all of you work very hard behind the scenes too, and in public, and reaching out as a community involvement to try and prevent our people from committing suicide. I understand last year there were 31 that committed suicide, and that a lot of this now is our youth. And thank you so much for working with our youth for prevention. And as you know, substance abuse, suicide prevention, and all that takes, like Carissa said, a lot of training. But I like the way that we are addressing it in terms of the holistic part, right? Prevention, treatment, rehabilitation, and then adding resources and partnering with non-government organizations, partnering with our law enforcement people, partnering with our VAs, partnering with our youth also, getting them all involved, and partnering with our schools. Because it's very key that we go into even elementary, middle school, and just teach our children about substance abuse. Teach our children about, you know, how to cope with them. How do you cope with the turmoil that you sometimes feel inside of you, and you see that the only way to have peace is to go into drugs. And we need to think about how we need to address that and the many challenges ahead. One of the biggest thing too that has helped, and I know Dr. Cooper Nurse was there, is the reentry program that we do at the Department of Corrections. And what we need to do is to kind of close that gap, right? From being incarcerated to going home in an environment. So what we are looking at is we're trying to see how we can stand up a rehab area, an area where they can come and continue the services and the programs so that they can have the stronger skills to cope when they have to go back into their home life, into their family life, into the environment, because sometimes the environment continues to be a threat to them. And how do you strengthen yourself to avoid that threat? It's not just with DOC, but it's with every client that we see. The other thing that I want to really emphasize, and I did a message on this one, is we are seeing a lot now of methamphetamine laced with fentanyl. Fentanyl, I have to say, coming from a medical nursing background, that it is a killer. You can take one pill of fentanyl and it can kill you. That's why JIPWIC has, and the law enforcement people, a program where we give out Narcan to the public. JIPWIC has a vending machine at their center that people can come and get this Narcan out of the vending machine for free. That's how serious and how concerning we are about fentanyl. Not just here locally in our island, but nationally. It's the same issue around. And so I take every opportunity to say to those people that do, unfortunately, are addicted to methamphetamine, please, please know that they are being laced now by fentanyl. And your lives are at risk if you continue to take it. We have JIPWIC here, we have WestCare, we have great partners that can help all of us prevent it, help treat it, and of course rehabilitation. So this proclamation of recovery and suicide prevention is just one way as a community that we use to make awareness out there more. We're going to use these events to push out more community outreach, more training, more understanding, because I'm telling you, and it's not just us. I just came back from the Pacific Island Forum. They are experiencing the same thing in the South Pacific Islands and of course in our North Pacific Islands. It is not just a national, it's a regional, it's an international issue. And all of you, in your training and in your commitment and in your dedication and in your love for our people, have continued to make a difference to the lives of our people. So I encourage all of you, from elementary, middle school, parents, religious leaders, government officials, we need to take this holistically as a community problem that we need to all work together. Really, because what is it about? It's about our families, right? It's about the quality of life that we want to live. And it's deserving of everybody here on our island. So our administration continues to do everything we can possibly do within our human resources, our financial resources, our training resources, and great leaders that are out there moving forward such great programs in all areas that I have mentioned. So I want to thank law enforcement, I want to thank the social workers, I want to thank the nurses, the doctors, allied health people, everybody, and especially all of you for all the hard work and the sacrifices, because you do make a difference to the lives of our people. Sus Masi, and let's continue the work together.
Good.
Jesus Mossy, Governor. I now want to proceed to the reading of the proclamation. There are two proclamations today. Our first proclamation is suicide prevention. This will be read by Mr. Brandon Holmes, Social Marketing and Communications Manager for the Guam Focus on Life Group, followed by the Substance Use Prevention and Treatment Recovery Month proclamation. Our reader today is Ms. Sula De Jesus, our peer specialist from the Guam Behavioral Health and Wellness Center.
Proclamation number 2024-78, a proclamation of the governor claiming September 2024 as Suicide Prevention Month. Whereas National Suicide Prevention Awareness Month is celebrated during the month of September, and National Suicide Prevention Week is the Monday through Sunday surrounding World Suicide Prevention Day, which falls on September 10th, a time when our nation and the world remember those affected by suicide, focus on directing treatment to those most in need, and raise awareness. Whereas suicide is the second leading cause of death for Americans between the ages of 10 to 14 and 25 to 34, the third leading cause of death between the ages of 15 to 24, and accounts for 1 of every 100 deaths globally. Whereas in 2023, our island lost 31 lives to suicide. Our youth and young adults are at higher risk of suicide, and nearly half of those who died by suicide in the last 10 years were individuals under 30 years old. Whereas although suicide is a difficult subject to discuss due to the shame and stigma associated with the topic, we must start the conversation and change the narrative to develop better methods for the sake of prevention and uplifting our community. Whereas prioritizing behavioral health is essential to our community and in our recovery from COVID-19 and Typhoon Noir, it has been vital to prioritize mental health and emotional well-being. These events have impacted mental health, and for some, the result has been isolation and loneliness, job loss and financial instability, and illness and grief. Whereas Guam has seen a growing number of trained natural support and community partners who have completed evidence-based trainings on suicide prevention, intervention, and postvention. Whereas in the last year, over 400 individuals in our community from diverse backgrounds and disciplines have attended suicide prevention trainings such as Living Work Start, Safe Talk, Assist, Assessing and Managing Suicide Risk, and Mental Health First Aid. Whereas the Guam Behavioral Health and Wellness Center continues to lead the charge to raise awareness on suicide and assist those at risk in partnership with both public and private entities, including the University of Guam Ipanengan Campus Suicide Prevention Center and the UOG Fellows, University of Guam Press, University of Guam Cooperative Extension Program, Guam Department of Education, Department of Youth Affairs, Office of the Chief Medical Examiner, Guam Fire and Police Department, Guam Office of Veteran Affairs, Guam Air and Army National Guard, West Care Pacific Islands, Game Time Incorporated, Guam Football Association, St. John's School, Kurosani Sensong, Ashinafi Long Foundation, and numerous other organizations who have participated in training and outreach activities to assist in reducing suicide on the island. Whereas Guam joined the Governor's Challenge, an effort put forth by the United States Department of Veteran Affairs and the Substance Abuse and Mental Health Services Administration to prevent suicide among service members, veterans, and their families. JIVWIC and the Guam Office of Veterans Affairs, along with the other government and non-governmental organizations, have worked together to implement local initiatives to extend helping hands to our brave service members, veterans, and their families who might be facing silent battles. Through this initiative, Guam has begun its efforts in establishing suicide mortality review processes on the island in order to inform best practices in suicide prevention. Whereas the JIVWIC's 988 Suicide and Crisis Lifeline operates 24 hours a day, 7 days a week, providing free and confidential support through phone, text, and chat to those in our community in distress. Over the past 2 years, the 988 Lifeline has received over 21,000 calls and celebrated its 2-year anniversary on July 16, 2024. And whereas our administration on World Suicide Prevention Day joined the nation and the World Health Organization, International Association for Suicide Prevention, and countries across the globe in mourning those who have died by suicide, supporting and recognizing the importance of prevention, and celebrating human strength and resilience.
Now therefore I, Lourdes Leon Guerrero, Magahagan Guahan, Governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim September 2024 as Suicide Prevention Month. Together in witness with the Segundo Magalahinguahan of Guam, we have caused the Great Seal of Guam to be affixed in the capital city of Agutnia on this 6th day of September in the year of our Lord, Anno Domini 2024. Viva!
Mrs. Masi, Governor, and Mrs. Masi to Brandon and Ms. Sula for reading those proclamations. This will conclude today's ceremony, but I do want to, actually, one more?
Recovery.
Oh,
Sula's turn.
because he turned the page, it felt very long. There's a lot of partners to recognize. Let's keep going.
One more.
Proclamation.
Number 2024-79, a proclamation of the governor proclaiming September 2024 as Substance Use Prevention and the Treatment Recovery Month. Whereas National Recovery Month is observed every September throughout the country to support evidence-based treatment and recovery strategies, celebrate the strength and resolve of those who strive for recovery, and recognize the dedication of service providers and communities who make recovery a reality. Whereas this year's theme, Recovery is for Everyone, Every Person, Every Family, Every Community, aims to underscore the importance of ensuring that all individuals have access to support, resources, and opportunities necessary for successful recovery, fostering unity in the collective effort to build healthier communities. Whereas recovery from mental and substance use disorders, including co-occurring disorders, is an essential part of health and one's overall wellness. Whereas no one in our island community is immune from developing mental health and substance abuse disorders, as these conditions do not discriminate and affect people from all walks of life, regardless of age, race, ethnic background, or socioeconomic status. Whereas treatment and recovery services for mental and substance use disorders and co-occurring disorder are effective, and people can and do recover on our island and around the nation. Whereas addressing and overcoming mental and substance use disorders and co-occurring disorders is essential to achieving healthy lifestyle physically, emotionally, and spiritually. Whereas the Guam Behavioral Health and Wellness Center, GBWIC, substance use treatment programs for incarcerated individuals, Judiciary of Guam, Salvation Army Lighthouse Recovery Center Sanctuary Incorporated, Westcare, Pacific Islands, and Togi Corporation are just in few of the organizations in our islands that assist to improving the lives of those affected by substance, those disorders, so that they can achieve wellness and lead rewarding lives. And whereas this month we can continue to emphasize that treatment is available and ensure those struggle in our community with substance abuse that we stand behind them.
Now, therefore, I, Lourdes Leon Guerrero, Magahagan Guahan, Governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam, as amended, proclaim September 2024 as Substance Use Prevention and Treatment Recovery Month. Together with the Segundo Magalahinguahan, Josh Tenorio, we have caused the Great Seal of Guam to be affixed in the capital city of Agutnia on this 6th day of September in the year of our Lord, Anno Domini 2024.
Thank you, Ms. Sula, for the reading, and thank you to our governor for the signing. Now that will conclude today's proclamation signings. I want to call up all our, actually, no, stay in place. The room is heavy on that side, so let us take the photo from this way.